All right, number 4. True or false? True or false. Okay. Overlapping standard error suggests not statistically significant. Yeah, that's true. What sort of diabetic medication increases the risk of vulvovaginal candidiasis? SGLT2 inhibitors, right? Okay, your patient has subclinical hypothyroidism. Treatment needed if there are anti-TPO antibodies, abnormal lipids, they're symptomatic, or ovulation or menses disturbances for the most part. All right. If someone comes into your, STI clinic, no rhubarb, get that bone out of here. Someone comes into your STI clinic and they wanted to know, Doc, the condom broke. What do I need? You tell them, boy, you need a HIV P24 antigen antibody screen. If you're talking to a patient and it's one of those long drawn out things, you need to explain the reason in greater detail, all right? If a family doesn't agree with end of life management, what committee should be consulted? The ethics committee. Um, what sort of distribution has a mode less than the median, less than the mean? A positively skewed distribution, with the modes less than the median, less than the mean. For someone who's rescued from a smoky fire, what should you measure in concern for CO poisoning? Carboxyhemoglobin, right? If you're dealing with an intellectually disabled patient, you want to determine if they have enough reasoning skills or a guardian that assists in their healthcare decisions for the most part. Some good thing to say to them is, tell me your understanding of blah, 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 okay? If a patient has an ACL injury, like a patellar rupture, but can walk, you got that? Thiazide diuretics commonly cause what sort of issue? Pancreatitis. If a patient has yellow sputum, what's the first bug you should think of? Aspergillus, right? If a person cannot copy simple sketches, where is the lesion in their brain? The non-dominant parietal lobe, most likely. If a patient has a DVT and PE history without cancer, how do you treat? An F10A inhibitor, such as what? Rivaroxaban, okay? If a patient has DVT, you want to discontinue menopausal hormone therapy. Got that? If a patient has a renal transplant, what are they at increased risk of getting? Renal, uh, um, increased risk of diabetes, and that's if they give a kidney. An old person with a dermatomal flank pain, how should you treat with oral valacyclovir, right? If vaccinated, immune healthcare personnel do not need to worry about shingles on patients, right? If a patient in your hospital has open shingles lesions, are they infective or not infective? They are infective, and tell them to cover those things up until they're crusted over. What sort of medication can help treat shingles pain? Gabapentin, right? Gabapentin can help treat shingles pain. A heart rate greater than 150 beats per minute needs what? This is a hint, that might cause a non-preventable adverse event, adenosine, right? If you have a concern for polymyalgia rheumatica, what lab test should you get? An ESR, right? If a kid comes into your hospital with DKA, where do you send them? Home or to the ICU? To the ICU, right? And if you have a concern for adult polycystic kidney disease, what sort of imaging thing should you get straight off the bat? A renal ultrasound, right? Autosomal dominant polycystic kidney disease. How do you treat that in ideal scenario? Treat it with ACE inhibitors and rigorous blood pressure control. Autosomal dominant polycystic kidney disease, family members should be screened if they're with a renal ultrasound if they're over 18, right? If a patient just got a surgery and post-operatively they're hypoxemic with secretions, what do they need? Suction and chest physiotherapy. If you suspect a bowel perf, what do you want to get? You want to get a chest and abdomen x-ray. If a chest x-ray shows peritoneum, what do you want to start? ART shows pneumoperitoneum. What should you start? You should start the IV antibiotics. If a person has a surgery, what can happen years later? You've seen it a lot at autopsies and whatnot. Adhesions, yep, obviously. FGR, fetal growth restriction, and absent or reversed end-diastolic flow is a sign of what? Impending fetal hypoxemia, and is also an indication for therapy. An elderly person with vague symptoms should get what sort of endocrinologic test? They should get a thyroid function test to start off with, right? A positive screen on a capillary test should be confirmed by what with regards to lead? A venous lead level, right? With lead toxicity, what are the people at increased risk of? Cognitive impairment. If someone has Dupuytren's contracture, what will they most likely also have or have increased risk of for the most part? Diabetes mellitus. Developmental dysplasia of the hip is associated with what? Abnormal acetabular development. A young child with a mass that's palpable in the abdomen, what is it most likely? A neuroblastoma, right? You're in your peds clinic and an irritable teen comes in. What do you want to screen for? Depression. Also note irritability in teens. You want to screen for depression just in general. What is the most important risk factor for osteoporosis? Age, of course. Okay.